Hello everyone, my name is Lori Dean. I am a psychology major and a CRISP scholar at Queensborough Community College. Today's presentation will be on the impact of COVID-19 on participation in mental health treatment amongst CUNY students. As we all know, COVID-19 has impinged upon our daily lives tremendously, and although the college student population is often overlooked, they too have been affected disproportionately. Post-secondary public university students specifically are faced with financial instability, remote learning challenges, and campus resource limitations. As a result, mental health concerns such as depression, anxiety, and stress has risen amongst college students as the visual below presents to us. As you may be aware, academic success, retention, and mental health are all relative. Research shows that students without pre-existing mental health concerns who were not used to isolation showed declining mental health compared to those with pre-existing conditions, and those demonstrating high levels of depression were associated with difficulty focusing on academic work. As the graph below demonstrates, the percentage of students experiencing impaired academics due to mental health reasons have increased from fall 2019 to spring 2020. This study aims to analyze whether COVID-19 has impacted participation in mental health treatment within the CUNY school system population. According to previous research, university health and counseling services are often underused by Black and Asian students, and so conducting this research could help bring awareness to the several ways students have sought treatment and encourage those who may lack mental health knowledge or experience with behavioral health to feel comfortable to do the same. Research shows that disease outbreaks comparable to COVID-19 has a history of being the catalyst for long-term mental health effects if not treated with immediate attention. Pedrelli discovered that undergraduate students are considered high risk for mental health conditions like depression, anxiety, and suicide. Lancaster recently reported that the pandemic social distancing policies negatively impacted specifically students of color. The targeted population will be CUNY undergraduate college students, specifically with an undergraduate level of education of ethnic minority, basic knowledge of mental health, and a willingness to share personal experiences. Individuals who do not fit this criteria will be excluded. I'll be using a stratified random sampling method and recruiting students through CUNY student research pools. Participants will be asked to access a 10-minute survey sent to their CUNY student email where they will be prompted to sign an informed consent. Thereafter, participants will be asked to answer a series of questions pertaining to COVID-19 and their mental health. This study will be using a survey research designed to collect preliminary data on mental health behaviors and symptoms of target population as a result of COVID-19's impact on their quality of life. Preliminary data collected from 94 currently enrolled college students resulted in the following. 22% of the respondents reported attending therapy since March 2020. Half of that group attended therapy for the first time after March 2020. Financial impact was significant as a barrier to accessing mental health and as a significant impact of COVID-19. Students 18 through 34, 65%, and those who identified as Black, 67%, reported loss of income as a result of COVID. The sample was split by age in regard to participating in therapy. The oldest students in the sample, aged 35 to 44, were less likely to participate in therapy ever and reported stigma as a barrier to treatment, while younger participants were more likely to participate in therapy ever and after March 2020. Those students who identified as Hispanic were more likely than other racial groups to report financial hardship as a barrier to treatment. They were more likely to seek therapy after March 2020. Students who reported the most distressed, for example, described themselves as severely impacted by COVID and reported multiple symptoms of distress, were also the least likely to participate in therapy. Students who identified as Asian between the ages of 35 to 44 reported the lowest participation in therapy ever and after March 2020, but reported the highest rates of COVID impact on their lives. Lack of information regarding treatment options and access to treatment were also reported as a barrier for young adults aged 18 to 24. No respondents above age 34 reported using any wellness apps or technology for support. Virtual interactions and family were the main sources of support for the majority of respondents. Though most of the respondents reported some level of distress in response to COVID-19, participation in mental health services was dependent on structural factors like income, access to services, and information about treatment options. The inverse relationship between level of distress and help seeking seems to indicate a need to focus on the barriers limiting student access to services. Students' reliance on family and friends and mobile apps during the pandemic seems to be related to isolation and convenience. Perhaps interventions that are multi-generational and instructional, especially around apps and tech, would be more useful during this time. This study has potential to not only bring awareness to the ways college students are suffering from the psychological effects of this pandemic, but future research on how college campuses like CUNY can provide both accessible and affordable traditional and non-traditional counseling services to their students. At this time, I would like to thank CUNY Research Scholar Program and Dr. Moody for this opportunity. I would also like to delegate this portion of the presentation for any questions you may have.